What are vaginal yeast infections? So, they're itchy and uncomfortable and no one really likes to talk about them. But vaginal yeast infections are very common in women. It's estimated that 75% of women will have at least one yeast infection in their lifetime. Thus, yeast infections can happen to anyone at any time. There are certain things that make getting them more likely. Most infections can be cleared up quickly and easily. So the vagina normally contains a healthy balance of bacteria and yeast. The hormone estrogen helps bacteria called lactobacilli to grow. This bacteria kills harmful organisms in the vagina and keep you healthy. But when something happens to tip that balance, a fungus called Candida can grow out of control and cause a yeast infection. Symptoms of vaginal yeast infections: itchiness and discomfort are the main symptoms of a yeast infection, but there are others. You may also experience any or all of the following: burning, redness, and swelling of the vagina and the vulva, the outer part of the female genitals, pain or burning when you pee, pain during sex, a thick white odorless discharge similar to cottage cheese. If you think you have a yeast infection, see your doctor before treating yourself. The symptoms of yeast infections are similar to other, more serious conditions, including sexually transmitted infections and bacterial vaginosis, or bacterial overgrowth in the vagina. An accurate diagnosis is important so you can get the best treatment. Causes of vaginal yeast infections. There are many reasons you could get a yeast infection, including hormones, change during pregnancy, breastfeeding, or menopause, or if you're taking birth control pills, can change the balance in your vagina. Diabetes. If your diabetes is not well controlled, the increase in sugar in the mucous membranes or moist linings of your vagina can create a place for yeast to grow. Antibiotics. These drugs can kill off many of the good bacteria that live in your vagina. The chest and vaginal sprays. The use of these products can change the balance in your vagina. A weakened immune system. If you are HIV positive, you have another immune system disorder, the yeast may also grow uncontrolled. Sex. Thus, a yeast infection is not considered a sexually transmitted infections. It can be passed from person to person through sexual contact. Treatments for vaginal yeast infections. Over-the-counter antifungal creams, ointments, or suppositories with clotrimazole or meconazole are the most common ways to treat yeast infections. This can take from 1 to 7 days. Your doctor may also choose to prescribe an oral antifungal medications such as fluconazole or Diplocant or Iverzacfim. Iverzacfim is taken twice a day for 1 day and targets the specific fungal cells behind the infection, while fluconazole is a single-dose pill which kills fungus and yeast throughout your body. If you're pregnant, it's safe to use creams or suppositories but avoid the oral medications. Oteseconazole has been approved for those with recurring problems with infections who will not be reproducing.